yesterday that diamond was very wrong on the policeman. So whole part is kind of like this was more this side, this was little more this side. Always remember straight line, side line. 1.5 tune here, 1.5 tune above. 3 tune straight, half tune this side, and 1 tune this side. Okay, so this line will come like this. Straight line. Mostly what we are going to cover, you want to remember the side part of your stomach. This is the belly, no? The side part of your belly. This one here. Okay, little bit up down point is no problem, but that was little bit more extra up down. Okay, so give this proper. We will do the practical little bit. Hello?
So as we see, it's half over.
Hello? SB15.
No, as we
No,
on the leg. And then below it. Oh yeah. So from stomach 25 to split 15, it's too short. Too short.
Everything teaching.
No.
Electro and
Stomach
moksha.
25 to the brain in the 8, it's 1.5 short, no?
Electro and moksha.
It's
This
easy
3-point electro,
if you learn from the
GT point
center,
box.
because from the
Okay.
center it's 2 tune, 2 tune, 2 tune, 2 tune, 2 tune. What point is the transverse part of the large intestine? You know the way the transverse part of the intestine that you've drawn going across, the walls of that?
You mean this one's here, right?
Yeah,
Mostly REN 10, 12 will help.
Ren 10, 12.
That help our stomach duodenum also, and that will help on these two. These two part is more ascending and descending. These two colon is more important. Maximum people having the more issues in this part. As the physiology also, when you read physiology, these two part is more
The descending part, isn't it?
ascending and descending both.
So, LI11, EUs and GT, and then here you said again. So GT, we have already the LI11.
The same. You
But
can
then
do
plus,
क्या बोल रहे हो? You can give immunity protocol, but in the inflammation swelling, we will not give electro. Okay?
one more time the LI3.
LI3. Where is everything like lever 3, LR?
It's in the
This one.
yeah.
Yeah. हाँ बोलो. Yes.
You know, with the kidney protocol, we do it on the back, do we? On the shoe. The kidney protocol, the UB one, that's on your back, is it?
Yeah, that protocol we have in origin treatment Jan22.3. That is back to point of organ.
Where is it? Where is the UB?
Between
Oh,
T12
T12
and
L1.
and T11. But do we
T12 and L1.
T12 and L1? But do we put it on the vertebrae? We put it one
No.
tune away from the vertebrae?
1.5 tune away from the tip.
Bilateral.
Yes. Why I kept the side? Because that will cover on origin treatment, that's why. What we are discussing now is the move point, and that is on the shoe point.
I know,
So we
yeah.
cover shoe
I
point.
just don't know where the points are for that.
It's good.
Ah,
UB23 kidneys. Remember?
पापा मैं वापस बता रहा हूँ सिम्टम के अकॉर्डिंग हम प्रोटोकॉल नहीं बताएंगे, टंग के अकॉर्डिंग प्रोटोकॉल लगाएंगे.
It's
Okay?
this one.
Never ever use any protocol as per symptoms, okay? Body symptoms. Because what we discussed, the body symptom is comes from many causes. Like bloating, related to vata also, related to pitta also, related to kapha also. What we check on the tongue, we use the protocol as per tongue diagnosis, not for patient symptoms. Understand?
So precisely LR3 is
So this is the liver 2
yeah.
here. From the here, one tune above, this is the liver 3. Okay. Whenever some people are suffering with gallbladder and liver issues, when you will press this point, the people having very stiff, just press your own self and see that is just smooth, not that it's stiff. In the evening, whenever you are doing protocol for some humidity removal or diamide, if there is a black cotton tongue or if there is a yellow tongue, check their patients just liver 3. Sometimes you feel the liver 3 is fully like become a stone, that much of the stiff. Okay, so liver 3 is the distal point of a great saphenous vein. The biggest vein is coming now. If there is a stiffness, means that muscle is creating lots of the vacuum in this vein, not allowing the proper circulation. When you will release that point, for example, when you give a deep moksha, then immediately they will patients feel some motions or maybe urination. After the treatment, they will go for the toilet or for urine or okay? The point is release immediately your carbon dioxide gas. Okay, so that's why I said sometime when you are doing the GT, so always try to check once GT and with this also humidity. Check the liver 3. Okay, so liver 3 is stiff, then you have to give the liver 3 and give deep motion. It's very effective point. That's why if you check in the book, liver 3 they mentions in a many different disease, like there is huge long list. They are saying for diabetes also, for blood pressure also, for the thyroid also, many. But the basic fundamental of the liver 3 to circulate your CO2. For example, this is your vein. My hand is my vein, and this is the tip of my vein. When this muscle becomes stiff, this muscle is creating a vacuum. Okay. For example, this is the one pipe. Okay. And this is the fully half of the pipe is the water. Okay. And one side you are just blocking this wide pipe, and this side you are trying to take out the water. The speed of water will reduce because you already hold that vacuum, no?
Oh, you're saying that. Okay.
Okay. When you hold pipe from one side, then this circulation inside the pipe, the water will not come out with full speed. Okay? Because to circulate the water, what we need? Gases. but you block the gas. Okay, there is outside pipe up in the just T break. You can check that technique. Okay, exactly same thing happened. This is the tip of the point of the grease separated vein, and lever 3 is here. Lever 3 is blocking this one. Then the circulation of the CO2 in the vein is not circulating properly towards your liver.
You're creating vacuum that you were pressing.
Yeah. When you
Just
press it,
touching it.
yeah. Okay, creating the vacuum. Due to that vacuum, there is loss of the issue. When you give the deep moksha and releasing the muscles, okay, reducing the stiffness, automatically, and especially people having the black feet, the diabetic feet and the ulcerous feet and this all black feet and less circulation in the feet, the all people, the burning sensation in the feet, the all people having these issues. Yesterday, have you checked that paralyzed guys?
Yeah.
You also having the same problem.
Yeah.
The kidney 2 and liver 3 are very stiff. Okay?
So one minute. Oh, sorry. I didn't write this. Where was maybe others have? So Moksha was on SP6, we're still on humidity.
Yeah.
Moksha was on SP6, SP26 and lastly,
And rain 4
and then
and the ginger in the navel.
ginger in there.
With moksha, okay?
Yes.
Yeah.
Two in and two down.
I have a question.
He said
Yeah, bolo.
GB26.
है ना अगर लेवल 3 में है ना मतलब स्टिफनेस हो तो किसी भी प्रोटोकॉल के साथ लेवल 3 डाल सकते हैं.
केवल डायमाई को अवॉइड करके बाकी किसी में भी डाल सकते हो.
Okay.
And stimulate is which one? The rest I can stimulate, right?
Yeah. The 40 cycle, which is screen
Yeah.
15, ST25, REN 10, REN 12.
Yeah.
But
Should we get some ginger to do a paste so we can use?
Paste is not.
No.
The raw material gingers, what we do that
Great.
Great.
graze properly and then we put the ginger and give the moksha.
In on top of the ginger.
Yeah, put in the navel properly. You can put little bit extra. Okay? Then give the moksha on the ginger. When
If we see that, if we see a yellow tongue today, let's do that. So
We learn.
we
We
learn.
practice.
there are many yellow tongue. I told you yellow tongue is very common. If we have in the evening times like 20 patients, then 4 patients you will find the yellow tongue. Okay? So best of luck. Yeah, what?
so about Daimai, so it's liver 13. And after the question is 1.5 tune down and 1.5 tune in. For the next point, with this GV26, or it's just two fingers, 1.5 tune down.
GB,
Down and in, or just down?
GB26. Okay?
I
If you want, I can give you revision of the diamond, quick revision.